Brooklyn Independent Television.
It's common medical wisdom that you need to feel rested to feel healthy. 8 hours of sleep is the traditional prescription. You also need to feel rested to get healthy, when you're in a hospital, that is. But as Healthbeat's Tati Amara discovered, at SUNY Downstate's Long Island College Hospital, it can get very noisy, and patients often find themselves trying to fall asleep in an audio minefield.
It's no question that we live in a noisy city. But noise in a hospital?
The noise can be a major obstacle for patients who are trying to heal and get better.
Imagine trying to recover with all this racket going on around you. In fact, we could hardly get through our interview without an interruption.
We also have
Nurse Kwashi explained that while obtaining diagnosis and caring for patients, noise is inevitable.
The lighting 16. We do have staff interaction, and that could be pretty hectic and very disturbing for our patients. Most patients, they think that hospital is a place where you come to rest, but it's totally the opposite.
But for the past 3 years, the hospital has been working on the problem.
So what we've done here at the hospital is trying to implement our Healing is in Progress program, which we want to bring awareness to the patients that we are trying to work on reducing the noise level at night. We also want to keep a constant reminder to our staff that they need to monitor their tones, their volume, as they come onto the units. So it's an awareness, it's an ongoing process. Sometimes we do better some months than others, but it's always we're always monitoring this. So
there's some noise.
There's
already.
noise, right? That's just an ice machine, all right? And it's the daytime. So again, these are some of the things that we try to mitigate at the nighttime. We try and make sure that the patients don't hear this ice machine going off at 12 midnight.
Your attention, red alert, first floor.
Noise reduction in hospitals is a nationwide effort.
And as you see around the country, every single hospital is trying to limit those. And we learn from each other. What works for some institution, we try here. And again, the publications out there are enormous about how patients are responding to the noise level.
And at Long Island College Hospital, overnight measures include no overhead paging and limited phone use. But how does the noise actually impact patients?
Not getting enough sleep leaves me, definitely at a lessened capacity the next day. So I would imagine for patients that's difficult.
Absolutely difficult. If you have a patient who may be scheduled to go for 2 and 3 hours of aggressive rehab to get independent so that they can go home, a lot of times not having enough sleep impacts on their ability to do so in the morning. And you'll hear most patients say, if I only had 4 or 5 hours of straight sleep, I would feel much better.
And according to a study from Texas A&M University, they would feel better. The study found that patients who slept better had lower blood pressure and fewer instances of rehospitalization. But they're also helping patients get more out of daytime hours by creating a more predictable environment.
So constant communication about what the expectations are limits their anxiety level. And again, they can't, the less anxious you are, the more relaxed you are. Hopefully you can get some cat naps during the day.
So remember, you're going to do rehab today because you have to move. I know it's hard.
Nurse Barrow explained how it's helped her patients.
Moving your limbs even while you are laying in the bed.
I understand.
Once you understand why you are going to be here and why your treatment has to continue, it makes it better. Because you know what's going on. It's not the unknown, and we all fear the unknown. You have any other concerns?
No, just thank God I'm living.
Okay, I'm glad for that.
In addition to these measures being beneficial to patients, they also play a role in the hospital's bottom line.
The patient satisfaction is key now, right? That has a lot to do
Absolutely.
with how
Patient
you guys...
satisfaction is so key to hospital reimbursement now. Right. Hospitals are being reimbursed on their quality indicators of providing patient care, but also patient satisfaction indicators. If we've seen a decrease in patient satisfaction scores in one indicator, then we know we have to work harder on that.
But she stressed they have a long road ahead of them and very big goals.
Absolutely, we'd like to be the destination hospital for all the patients in Brooklyn, and again, we'd like to be in the top 10%.
I feel like it's a work in progress too.
It's always a work. It's always a work in progress.
For Healthbeat Brooklyn, I'm Tati Amara.
Watch this and other Brooklyn Independent Television episodes online at bricartsmedia.org/BIT.